well as well. All right, so we're ready to start. So for those of you who don't know who Felicia is a biopharma accountant executive at LifeSci Communications. She has worked in various roles in the medical field, with focusing on oncology, pediatric neurology, and infectious disease clinical research. Her prior roles include being an entrepreneur, a restaurateur, and a chief operations officer. Through her various roles, she has gained experience in patient recruiting, experimental design, performance tracking, risk identification and mitigation, interfacing with study sponsors, maintaining a chain of custody of day-to-day activities. She also has experience in social media management and franchise development. I mean, you think the bio was over, but I'm continuing. Prior to joining LifeSci, Felicia received her Master's of Science in Cancer Biology, Prevention and Control from a joint master's program at the University of District of Columbia and Georgetown University. She was the manager of operations at Adelia Therapeutics, Inc., where she led planning and execution of projects with external partners, as well as a wide range of internal initiatives. Felicia conducted clinical research on Moderna and Novavax COVID-19 vaccine clinical trials while working at Emory University School of Medicine. Felicia received her bachelor's degree in biology from Fort Valley State University, and she also hails from the Montego Bay High School for Girls. Welcome, Felicia. Show us some love in the chat. Show us some love in the chat.
Thank you. Hi, everyone. Happy Monday.
Happy Monday. How are you feeling, Felicia? Are you excited? Are you ready?
Yes, I'm excited and I'm ready to see the questions that you have for me, since I was previously briefed, so this should be fun.
Right. All right. So let's get right into it, right? So from your bio, I heard something that was quite exciting, and this is where I wanted to start. COVID-19. I want to start here. How did you navigate your career in the pandemic, and what was it like testing drugs to help at this time?
So in the pandemic, when the pandemic started, I was working at Emory University, but I was working at the Winship Cancer Institute on oncology trials focused in the head and neck space and the liver cancer space. When we got locked down and I had to work from home, it was interesting, but I usually give myself like a 1 year deadline to review my role and decide if I want to apply for a higher position or where I want to go. So during the pandemic, I applied for a level up from the level that I was at. I was a clinical research coordinator 2, and I wanted to apply for a 3 position. Mm-hmm. So I applied for a position that I saw in our careers portal, and it was a level 3, and it said it was still in the Atlanta area, but it said I didn't read it in detail. I was just like, okay, the description, I can do these things.
Right.
So when I applied, I heard back from the site manager, who ended up being the principal investigator, for COVID trials. And I was like, oh, this would be cool. I would love to know more about the thing that has the world shut down. So right. I interviewed for the position, I got accepted. And when I got there, that's when I learned that it was actually the Moderna vaccine, and learned so much about COVID, the vaccine, and was on calls with the Surgeon General, Dr. Fauci. I was so proud of that moment because it allowed me to etch my name into history. So that was pretty cool. You said how I navigated during COVID. What was the other half of the question?
I think you kind of answered both. The other half of the question was, what was it like testing drugs to help at this time? And
oh yeah, it was super cool because it was learning the ins and outs of it, and knowing so seeing everything that was being said about the drug, mm-hmm. and how people were thinking that it's gonna turn you into a zombie. because I remember when I got because the Pfizer vaccine was available before the Moderna vaccine. So I got the Pfizer vaccine because of the science and I wanted what was readily available. So it was pretty cool having insider knowledge on the benefits of the vaccine, so I could relay this information to especially my Jamaican people, like my family, my friends. I even did a panel with one of my mentors to a church group that is predominantly African American to give them knowledge and insights on the benefits of the vaccine and to like debunk the myths affiliated with the vaccine. But it was really great. It was a really great experience, especially translating the hard science into layman's terms. That was one of my favorite parts too.
That's great. I feel like you saw my questions because my follow-up questions was like conspiracy theories. Like, what were your friends and your family and your colleagues saying about the vaccine? But you kind of touched into that a little bit. So I don't know if you want to share like just an experience, because I know when it just came out, especially Jamaicans, we were like anti-vax, like, oh, we're not, no vaccine. I'm vaccinated. Let me just put that out there. But what were some theories you were hearing, and how did your friends and family relate to it?
So some of the theories that I heard, like I think it was my stepbrother specifically messaged me talking about, are you a zombie yet? And I was like, no, I'm not. It was very interesting because especially people of color, you know, we have PTSD from being used in like the syphilis trials back at Tuskegee back in the day. So because everyone didn't really know how the patient population looked for when they were testing the drug, that was a fear of theirs. If my working directly on the vaccine and seeing the efforts that my site specifically put into recruiting people from like a diverse group of participants, I was able to give them this insider knowledge to let them know, like, hey guys, I work with different patient populations. They have a lot of different underlying illnesses. I talked to some people who had diabetes, everything you can think of. The patients were experiencing it. And so it was good to speak from that perspective to let them know, like, they got the vaccine, different doses, and they didn't have any adverse reactions. The side effects were minimal, if any, and you are supposed to stay on site after you get vaccinated for at least 10 to 15 minutes. So that was kind of reassuring to let them know if you're going to have a reaction, a lot of times it happens immediately or within minutes. So if you're fine after that, the craziest thing that will happen is, you know, fever, maybe chills, but those side effects those are better than potentially getting COVID and or dying from COVID.
Right.
So.
Right. I love that you shared that just for us here in this space, because I know it's still a touchy topic and we're coming out of COVID now, but a lot of persons in Jamaica still haven't gravitated to getting vaccinated. So I'm really happy you could just share that information with us. All right, so let's backtrack a little. We want to talk about Little Fell. Did Little Fell, right, who grew up in Lucy, Mobay, always knew that she wanted to be in science?
No, Little Fell wanted to be a lawyer, and I think I was 6, and my mom is on the live too, so I don't even know if she remembers this, but when I was 6, I was like, I want to be a lawyer, but in my mind, it was about the fly dressing and the heels and all of that, or 6 or 8, somewhere there. And I used to want to be a lawyer, and my mom was like, you want to tell lies for the rest of your life? So after that, I was like, okay, what else can I do? So I was like, okay, I'll become a doctor. And I've always just been naturally good at science. It was the one subject that, even when I was at Mobay High, I didn't have to try too hard to do. And I would look at my report from Jamaica, and I would always have an A in science. So when I moved to America, I was like, I always have an A in this subject area, so maybe I should hone in on that and focus on that. So Phil was like, all right, she wants to be a doctor. So that was the goal from Little Fell to know.
Okay. So we know that you're a biopharma account executive, but for people like me that I don't, what what does a biopharma account executive actually do? Like, what's your day to day like?
So my company is a communications company, and what we do, we work with big pharma and biotech companies who are in different stages of drug development, whether they are in the preclinical stages where they're just testing out their theories and trying to develop a drug to treat a certain disease, or they're in the clinical stage where they are actually in the clinical trials, and actively trying to move into like a drug application or FDA review, or they're in the commercial, on the commercial side where they have a drug and they're actually selling it or producing it for patient use. So my accounts that I work on are mainly in the clinical stage. I just got added to one account that is both clinical and about to be commercial. But my day-to-day looks like meetings with my colleagues as well as my clients. I'm one of the scientists on the team. So what I do is what I used to do in clinical trials, it feels like, and I didn't even know there was a company out here that did that, but I work to simplify their difficult science for the layman to understand. So we work on getting, we call it their messaging. So what are you trying to tell people, and how can you simplify your story where anyone can understand it and know, okay, this is what they do. So I remember when I was interviewing, they asked me, when did I know I wanted to work in communications? And it was my first time hearing about this company, but the backstory I gave was working on the clinical trials, because you have to do what is called informed consent, where you tell the participants what the trial is about, what they're getting themselves into, what it all entails. And so that was literally simplifying the science for the layman. So I basically do it on a bigger scale for bigger companies.
I feel like this career, I don't know if anybody else in the chat is feeling like how I'm feeling. This is so cool. It's like mixing science with a little bit of PR, marketing. Like, I didn't know that was a
Me
thing.
either. It's literally that. So we're the PR people. So my day-to-day also involves writing press releases, reaching out to reporters, talking to these reporters, setting up interviews for the CEO of the company, or the CMO, which is the chief medical officer, or the CFO, somebody in the C-suite as they call it, to meet with the reporter. And they have publications in different outlets that are trade outlets for, like, whether they're biotech trades. We even have some of our clients featured in like Forbes magazine, or on CNN or ABC News. So it's really cool. And then depending on the stage in which the client has been added to the company, we do what we call media training, which is one of my favorite things. It's not inside the realm of what I do, but I enjoy it because we're training our clients' spokespeople to talk to the media, so they're better equipped to get the messaging across and get what they do across to the reporter and to anyone listening or reading about their story.
I feel this is so exciting. You know, for a girl that's anti-science, I'm an anti-science girl. Ooh, science is, but this just makes science and a science career sound so much more appealing. It kind of just lively up a little bit. I like it.
Yeah.
I've never met anybody that does this before, and so I love that you're just sharing, so everybody on can say, "Whoa, wait, hold on! I can mix science with PR, I can mix science with marketing."
Yeah.
I love it, Phil.
And then our teams too, just to shed, give some more insight. We have different teams. So we have a social media department, a digital department. So if you're into graphics, if you're into social media and paid social media, we have the media team, of course. So if you did journalism, or I have colleagues who have no science background, but they understand the PR side. So with that, they're able to help us bridge the gap. So my company is so unique, and I absolutely love it because I work with MDs, PhDs, MBAs, every degree you can think of. We all come together to be like a powerhouse for our clients.
I'm speechless because it's so exciting. And so it makes me wonder, what's the best feature of your job? Because everything sounds exciting, the whole day-to-day about media plus the science, and you bring it all together. But what's the best feature of your job currently?
I feel like so far, and I've said this since the day I started, and I am about to be a year in, and it's the best job I've ever had because it helps me to utilize my entire skill set. Like, I do a lot of independent work, so that taps into my entrepreneurial background. It helps me to keep my scientific knowledge up to date. My public speaking skills have to be well improved. My writing skills have to be good because I am literally talking, and writing to reporters, and, any error can get scrutinized and cause my clients to not be featured in their outlet. But one of the best parts is just I would say two parts, putting everything that I've ever done together and the culture at my job. We look out for each other. We work together for the greater good of our client. It's not like I'm going to step on your toes, I'm going to throw you under the bus. We have a great checks and balances system where there are people who are above me or who have more experience in certain things. They're able to check my work. So we're always putting the best out there at all times. And I love that.
I love that you say it encompasses, or it gets to encompass all your skill sets. A lot of persons don't get that opportunity. And so I am so happy that you have found that job, and I put that in caps, that job that really gets to use all of Felicia. So that's great.
Thank you.
So I want to shift over a little bit.
Okay.
And I want to talk about doing a joint university master's. Not many persons do that. That's not something that you hear about all the time. How were you able to do that? How did you find that master's?
So when I was in college, I was a part of an organization called LSAM. It stands for Louis Stokes Alliance for Minority Participation. And what it does, it helps students of color, is the best way to put it. It opens more opportunities for us, opens more doors basically, so that we can have more internship opportunities, mentorship, do more research, just to enrich our applications for like graduate school, for example. So I went to I was also a member of this National Scientific Honor Society called Beta Kappa Chi, and I went to a joint conference for Beta Kappa Chi National Institute of Science, and I found the program there, and it was a master's in cancer biology prevention and control. And when I was in college, it was in my cell and molecular biology class. I remember the story so well. My professor had said cancer is the only cell that can grow anywhere in the body, and I literally immediately fell in love with the term. And I'm like, okay, cancer, like this cell is like a super cell. It's like, I want to know more. So when I found that program, I was like, okay, this is cool. Had it in my back pocket, and I was doing a 3-2 program where I did 3 years of my 3 years at Fort Valley State University, and then 2 years at another institution after I graduated. And then it was a time to graduate and apply to the second program. And I was like, instead of doing a second bachelor's, I could just do a master's. And so I dug into my files and found the contacts that I got from the conference, and I applied to the program, and I got in. And plus, it was one of the only master's programs I ever heard of that was paid, and it was through LSAM. It was called a Bridge to the Doctorate program, where you start there, you figure out like what you would do if you decided to go to a PhD, and the PhD would be paid for as well. So that's how I found that program. And it was a joint master's with the University of the District of Columbia and Georgetown University, because they have the Lombardi Comprehensive Cancer Center. So their resources were beneficial to us for our thesis purposes. So that's how I found out about my program.
Listen, I hope everybody is taking notes from Felicia right now, okay? Felicia is very prepared. Felicia went to a conference, heard this information. She didn't know if she was going to need it right now, but she took notes. She kept those notes, and when she was ready to apply, then she applied. And I hear Nakia coming on with the paid master's part. When I heard that, I said, wait, don't gotta say anything else, right? And it became a paid master's. And I think that's so amazing. And there's so many lessons from this one story that you just shared. where you hear something as young people, we need to always remember that if you hear something and you like it, you may not need it right now, but just take it down, because there's gonna come a moment in time where this particular thing or this particular information will become applicable to you. And so, Felicia, big up yourself. Right now, you're just a star. I'm fangirling. Can you tell I'm fangirling? Everybody in the live is fangirling. We just
thank you guys. Thank you.
And so something that I really wanted to talk about, being a woman in STEM, how important do you think STEM careers are in 2023, right here, right now?
I think STEM careers are super, super important. They were always important, but now more than ever, because I feel like representation is so important. And growing up as a little girl from Cascade, Hanover, I don't recall seeing very many people who looked like me doing different careers outside of being like a lawyer or a doctor or an engineer per se. But being in the field, I feel like it'll be very impactful in 2023, especially in the age of social media is everything, so they can see that people are still out here doing it, trying to make a change, trying to do different. And outside of the tech space as well. I know that's super important and big as well, but the sciences are still, we're still doing our thing, making change, affecting change. So yeah, I think it's super important.
And I think more than ever, especially coming out of that pandemic period, we see the importance of science really playing a role. We might have heard about it, skimmed over in it in 9th grade, but we really lived through it and realized just the importance of people like you and how much we need people like you, and just what you do. So I see a question in the chat and I just want to hold on to that. But there's one more question that I just want to tackle. Being one of those interviewers that want to ask all of these little, things. The term women in STEM, it really came about, I guess, 5 years, let's say 5 years down, 4 or 5 years, when feminism was on its flea, and we realized that women, we need to take up more space. And so what's some motivation that you would share to a girl who just hear that this is not her world, like whether it's being an engineer or being in sciences, like that's not your world, especially when you grow up in a third world country and you hear, well, there's nobody to do that, so you want to do that, that sort of mindset. What type of motivation would you share with someone?
Ignore them. Ignore every last one of them. Take it from me. If you listen to people, you will never accomplish anything, not even close to your full potential. You have to believe in what you want and never stop dreaming, never stop believing, never stop reaching, because one day you're going to thank yourself for that. So if someone is telling you, you can't do this, people don't do that, okay, tell them you'll be the first to do it. That is how we have so many great things. That's how we have heating and computers and Instagram Live, because somebody said, okay, it's never been done, I'm going to do it. You're not going to stop me. All the women who have affected change in the past and the ones who will affect change in the future, they don't listen to outside opinions. They stick to what they know and what they want to do, and they go for it. Oh, and get you some new friends and new people to talk to who will push you, build you up, and say, yes, you can do it. Go for it.
Oh, that's a word. That is a word. If you didn't take anything else from this, Felicia said, ignore them. Okay, just get you some new people to push you forward. I love that. I love that. I love that. And I saw a couple questions in the chat, and I just want to go back to a couple of them. So do you have any advice, Felicia, for someone who wants to become an engineer?
So for someone who wants to become an engineer, my dad's an engineer, my sister and my cousin too. My best advice would be find someone who's already an engineer to be your mentor. It never hurts to have somebody who has insider knowledge in what you're trying to do. They could probably help you hone in on what specific type of engineer you want to be. So get a mentor, do your research, and see what it entails. If you're in college, make sure you're talking to your advisors about taking the correct classes so you don't end up taking classes that you don't need where you're in school an extra semester or two. So you want to make sure you're focused on the specific type of engineer you want to become. You have a mentor in that space or mentors in that space who can advise you and guide you, and try to do internships so that you could get hands-on experience, because that is priceless. Because that's how I learned I did not want to do a PhD or bench work when I did a summer internship. So definitely explore all avenues you can, just so you get all the knowledge you need to pursue the career path that you think will be best for you.
And I love that you mentioned get a mentor. Head over to, we're right here on the page, Minds of Jamaica. Head over to the link in our bio, the Minds of platform, and really just sign up. We have engineers on the platform too, so you could find your mentor right here. So if you're not a part of the Minds of Initiative as yet, sign up. We have lots of mentors that are ready to answer your questions, as well as stay tuned to Mentorship Mondays, because I'm sure we're gonna have an engineer sometime soon. Do we have any further questions for Felicia? I'll take one more from the chat. Any burning question? Anybody have a burning question that they just want to ask Felicia right now? This is your moment. Don't be shy. All right.
Abby also asked for information to get scholarships and find programs to be around great minds. So if
I missed that one. Thank you.
Worries. So for scholarships, say you're interested in a certain institution, you can go on their website and look up the scholarships that they offer. You can also try to reach out to somebody in the admissions department at that institution. They usually have great insight on scholarships that are offered to the school. I know when I moved here, I didn't know much about sororities or Greek organizations. And so my dad was on me and my sisters to apply to different programs, different scholarships. But through him and talking to different people, I was able to apply to different scholarships that were available to the school that you wouldn't necessarily find on the school's website. So that's a great way to get some insights on scholarships as well.
Sounds good. And I'm sure if you have any further questions, you can head over on the Minds of Initiative platform and reach out to Felicia. She is a mind, right? And so she'll answer your questions. I see another question. Do you know any teachers or lecturers that have that do dentistry?
So I don't know any instructors or lecturers, but I have a host of friends and associates who are in the dental field. It depends on if you're in Jamaica or in the States. I could probably connect you with someone. I used to want to go to medical school. I know the whole process. I applied, I actually got in. I just didn't go, and I didn't tell anybody in my family. So the ones who are joining, who are on here, I got into medical school and didn't go. Sorry. But you're in Jamaica. Okay, I can reach out to a dentist or two that I know there and see if they would be open to mentoring you to help you on your journey to get into dental school.
All right, awesome. awesome. So I get you can reach out to Felicia and she'll provide you with that information. And we are just about wrapping up, Felicia, but we do have another giveaway, and we're trying to have giveaways for every single episode of Mentorship Mondays. I see one more question. What's the best pick for CXC subjects?
So I didn't do any CXCs at all. I left Jamaica at the end of grade 10, but I can direct you to someone who did CXCs in Jamaica, but from what I've gathered, it's important to do the subjects that align with the career path you're trying to pursue. So if you're trying to do engineering, you want to make sure you do the physics and the maths. If you want to do medical school or dental school, you want to make sure you do the biology, the chemistry, the physics. Of course, English is in there, but that's as far as I know. So I could definitely point you to someone who will probably be better equipped to give you insights on that.
Yes. And so I just shed light on that. So Felicia was right. Bio, physics, and chemistry, and maths if you're going into engineering, and Cape maths or add math, anything like that. So you want to think about, doing subjects that are in line to your career path for sure. All right.
Actually,
so fast. We're to the end of this, and I want to thank you so much for coming out here on Mentorship Mondays and sharing gems, straight gems. We're so proud of you, and we're so honored that you would, come on and share about your career journey. And I'm sure everyone, including myself, learned so much, and we're so appreciative of that. So thank you so much.
you're welcome. Thank you so much for having me. I always enjoy sharing anything I've learned, and this is my way to reach back and pull people forward. So don't be afraid to reach out on the Minds of Jamaica Initiative platform, or if it's easier to send me a DM on Instagram, I'll answer any questions you have or get you to someone who has the answer to your question.
All right, awesome. So you heard it here. You can reach out to Felicia and she will answer your questions. And get ready for another episode of Mentorship Mondays coming up March 13th. It's every second Monday of every month this year. And so you don't want to miss the next episode. So be sure to tune in. Thanks to everyone for joining.
Thank you, guys.
All right. So bye, everyone. Have a great rest of your Monday.